So hair restoration surgery is something that I do under straight local anesthesia. It's a really well tolerated procedure, but like anything, it provokes a little bit of anxiety in patients, and so I talk to them beforehand. And so I like to tell you kind of what I do. You'll come in the morning, you'll have a big breakfast, which is nice. You will. We've already taken pictures of you at this point, and I'll mark out on the scalp exactly where we're going to put the hair because that sort of alleviates, your the not knowing what's going to happen. And so after that, we'll go to our procedure room. I'll numb up the donor area, and we only trim the hair that we're going to harvest, so you don't have any bald scalp otherwise. And then we will harvest, close things with sutures, and then I usually have 4 assistants or so that will literally split hairs and make those little grafts into the natural groupings of 1 to 4 hairs, the so-called follicular units. In the meanwhile, I'll make the little sites. We're going to put them in the right orientation and pack tightly together, and then we'll start placing those grafts in the holes. During this time, you'll be watching a movie, listening to some music, maybe taking a nap. Very comfortable procedure done under straight local anesthesia, so you really don't have any discomfort at all. The whole procedure takes around, for the average case, somewhere between 4 and 6 hours. You can take a break in between, have lunch, and then you'll go home. And when you go home, we give you some products that are copper peptide-based products that help accelerate healing and increase comfort. So that's great. I'll see you back in about a week, and we'll get the sutures out. And at that time, the scabs where each place where we put a graft is, there's a scab, they'll start to be falling off, and we'll accelerate that process as well. So you're really good to go, at about 8 to 10 days.